fees doable? Is AMC Part 1, of course, even if Part 1 is a little doable, they feel, is AMC Clinical really doable? Will we get stuck in mid-pathway? Like we are neither that side nor this side.
Australia it is definitely a doable exam as I've done both, and definitely a doable exam. And we collaborate on helping candidates to pass the exams as well.
Hello everyone, welcome to Go Campus. So this episode is a sincere and honest attempt to answer the questions many international medical graduates, especially from India, have when considering a move to Australia. Now today, more and more medical students and doctors are exploring international opportunities for higher training or work. But many find themselves stuck midway, like unsure of next steps, lacking guidance, and feeling the weight of uncertainty. It's a painful space to be in when you know that you're really capable but you feel directionless. So to bridge this gap, we created a platform where experienced professionals can guide aspiring doctors, a space for mentorship, clarity, and real world insights. So that's how Go Campus World was born, to connect mentors and mentees in a meaningful way and help transform your dreams into actionable plans. So, we are joined today by Dr. Balan, a proud KMC Manipal alumni who has successfully navigated this path herself. So, welcome, Dr. Balan. We are truly excited and honored to have you with us today.
Thank you, Ashwini. I'm really happy that you and very excited to be here today. And thank you for creating this platform to have me on.
Thanks, Doctor. So, Dr. Balan passed both her AMC Part 1 and Part 2 in her very first attempt, and she's currently working as an Emergency Medicine Registrar in Australia. And what makes this conversation even more special is that Dr. Balan is not only an emergency registrar, but also an elected IMG representative with the AMA in Western Australia. She's actively working to support and advocate for international medical graduates. She's been through these challenges of decision making, exam preparation, job search, career progression, fellowship exams, you name it. So there is no better person to guide us through this journey. She's the best person who can answer all the questions you have at this point of time in regard to moving to Australia. So, in this episode, we are going to talk about pathways for IMGs, that is standard, competent, specialist, very briefly about it. We're also going to talk about difficulty level of AMC exams. We're going to talk about why AMC clinical slots are hard to get, how difficult it is. We will also talk to doctor about how easy it is to clear these exams and impact of a clinical gap and how to manage the gap on your CV. We will also explore non-clinical career options for doctors in Australia, career progression in Australia, and many doctors do ask us, what is this area of need? Which specialties are in demand? So, doctor is going to talk about it. And also, many students do ask us, or many parents are mostly asking us about this. Is there racial discrimination in Australia? Are our doctors treated at par with the local doctors over there? Is there any bias during hiring, training, or further career progression? So, we are going to cover all the questions that you've asked us. We are going to get doctors' insights on the same now. So, starting with the episode, thank you so much, everyone. Let's start the episode now. Hello, doctor. Welcome again. Thank you so much for taking time to be with us today.
Thank you, Ashwini. Thank you for having me today. I'm excited to talk about the AMC pathway and guide all the candidates out there that are looking to settle in here in Australia.
Okay, I mean, these days, especially now, as you know, whichever country doctors look at, especially IMGs, let's say MBBS doctors, the pain point is every country has become very competitive. You talk about India, we know in India, getting a government seat is extremely competitive because your rank has to be there within All India rank 4,000, 5,000 to get good clinical branch. And later on, we have private seats, deemed seats, management seats, NRI seats. We know these are on a higher side, and not all are comfortable in paying such high tuition fees. Hence, India gets very competitive in terms of securing a clinical seat. You talk about UK. I guess we all know the current situation in the UK. We've also covered an earlier podcast where doctors spoke about how is the current job market scenario for MBBS doctors in the UK. So UK has become extremely competitive. Talking about US, we see everyday doctors. This is what we've been doing since last 10 plus years. We only cater to doctors. We help them, we guide them, we assist them in exploring India, UK, Australia, US, and now we've introduced even Middle East. So when we talk to doctors who are aspiring to move to the US, we get many complaints. Their visas are getting rejected. They're confused because if visa is not happening, they cannot go to US, they cannot do their USCE over there. So a lot of confusions over there. And of course, now coming to Middle East, again, we've already spoken about this in our previous video also. Yes, Middle East, there is a requirement for specialists, consultants, but for general practitioners, that is what MBBS doctors are eligible for. That's again extremely competitive. So similarly, talking about Australia. Now, Australia also, like many doctors reach out to us, is AMC exam really tough? Is it okay? Is it possible to pass? All these questions that they have. So in this session, we'll only exclusively focus on Australia. Doctor, the first question that we receive a lot from students or parents is on, is AMC doable? Is AMC part 1? Of course, even if part 1 is a little doable, they feel, is AMC clinical really doable? Will we get stuck in mid pathway? Like we are neither that side nor this side. What do you have to say for it, doctor?
So Shuni, that's a really great question. And I think that's a question that's come up multiple times, even on the questionnaires that I hold. And it's a very good question because we see candidates neither there, neither here sometimes, and candidates like myself who have made it through part 1 and part 2 and have worked. The thing about Australia is it is definitely a doable exam, as I'm one of the, as I've done both, and definitely a doable exam. And we collaborate on helping candidates to pass the exams as well. But like I said, like the exams are definitely doable. However, they are tough. No country is going to make it quite easy for an external doctor to move into one country. And also, when they do, they want to make sure that they need a way to narrow down the applicants. Because in one application, you have thousands of applications coming from all over the world. So they need a process to narrow it down. However, that being said, the AMC is pretty straightforward, especially part 1, where it is they have a cohort of diseases that are seen in Australia. They have guidelines that are in Australia, and they like to stick to that. And they're mainly checking if you are aware of those guidelines and what the disease cohort that you see in Australia. So that's part 1. For part 2, yes, there is a bit of subjectivity for the exam. However, it's not an impossible exam. There are candidates that have even passed this exam on their first go. I passed my exam on my first go. And there are candidates currently still passing in their exams on their first go. The second part of the exam can be a little tough because how we practice medicine in one country is different to how you will be practicing medicine in another country. And what Australia is looking for is, are you aware how we practice the medicine in our country? And because that is what we're expecting you and hiring you for. So the idea is that they're hiring you for a resident medical officer position. So they are not expecting like an expertise of a fellowship. And when you when you present that case in an exam in that level, the failure rates tend to be a bit higher for that reason. So in short, yes, definitely a doable exam. Yes, it is. There are obstacles. It depends on how determined you are. That will determine if you're going to get through both exams.
Thank you, doctor. And also, I would like to know from you, of course, standard pathway is very much spoken about. Many doctors know standard pathway. They have to do their AMC part 1, part 2. If they get a job after AMC part 1, they go there, do their clinical or WBA. I think standard pathway is very much spoken about. But many postgraduates are approaching us, inquiring about what's the pathway for them. Like, is it specialist or is it competent or is it, I think there's a new pathway that's introduced, something called expedite pathway. Can you just please share little insights on this?
Yeah, absolutely. So the specialist pathway is specifically for candidates who have completed their postgraduate training and plus have completed, the recent change is that that you need 3+ years of experience. And especially for Indian candidates, this is because there's a clause stating that the postgraduate training should, if it's less than 3 years, less than the Australian postgraduate training, which is 6 years, if it's less than that, then they need 3+ years of clinical experience. That is not part of your postgraduate training. So what that means is you must have completed your postgraduate MS or MD, then you must have 3+ years of experience. So those are the candidates that fall under the specialist pathway. And this specialist pathway is divided into 3 parts. So first is the short-term specialist pathway, second one is the specialist pathway itself, and third is the expedited pathway. Now, candidates who are from India don't fall under the expedited pathway currently because it is only for 3 main specialties at the moment: GP, obstetrics, and anesthetics at the moment. and they have only opened it to selected countries such as UK, Ireland, all your competent authority pathway countries. And in that, mainly UK and Ireland are what they have opened it up to so far, and US in one of them. That takes us back to the specialist pathway. In the short-term specialist pathway, it is for candidates who are looking to come to Australia to possibly do a fellowship, a thesis, or when they're doing their super specialty training and they want to get an extra, do it in a foreign university to get that extra fellowship or a certification, you come through this pathway. It's maximum for 18 months that you can stay here. There are candidates who have gotten reference through this pathway and then converted that to a specialist pathway. Now, the specialist pathway is a pathway where you're looking to relocate after your postgraduate. And the role you'll be applying for is called a service registrar role or a non-trainee registrar role. So those are roles that non-trainee registrar roles are roles where you have picked the area or the specialty of your choice. So you may be medicine, you may be surgery, you may be, obstetrics and gynecology, and you are sticking to that specialty. You will not be rotating through different specialties. You would be just sticking to that, and you'll be hired as a senior, in a senior position where you will be overseeing resident medical officers, interns, all your junior doctors, and participating in this. Once you've applied and you started working here for about 6 months, you have some Australian references, and then you're going to lodge an application to the Royal College of your whichever specialty you've come in with. And that's how the specialist pathway works.
I think that was a lot of detailing. So if specialists are watching this video, if you wish to discuss one-on-one with Dr. Balan on opportunities, how to navigate the pathway, please log into www.gocampusworld.com to book a one-on-one session with Doctor. So moving ahead. Now, Doctor, I think recently, 3-4 days back, AMC Clinical slot booking was open. I think sadly, we could see so many doctors reaching out to us saying that they were not successful in securing a slot. Why is it so difficult to secure one AMC Clinical slot?
Well, it actually goes back to the first question. Is it a doable exam? It's definitely a doable exam, and people are realizing more and more that it's definitely a doable exam. So once that everyone wants to, pass these exams and get into the job market, because we are short of doctors. So there is a lot of demand for it. There was a period during the COVID time where they either tried for the job without the AMC2, or that there was actually not many applicants. So that's why there was a bit of a free period. But now most of the candidates that do get a job are after AMC Clinical 2, and some of them without the AMC Clinical 2 as well. But the hospitals prefer after AMC Clinical 2. So that's why there's a lot more demand for candidates registering for the exam. Two, we've also seen an influx of the amount of candidates moving to Australia. So it's doubled in just 2023, 2024 to 2024 to 2025. And last but not least, the other reason is that if you do get a job after AMC Part 1 and you get a job on limited registration, your registration can only be renewed 3 times. Yeah. So a lot of them are coming to the end of the 3 times. So they need to get that slot in the 3 years. And the other reason is also a lot of hospitals, because we have a lot of doctors after AMC1 and everyone wants WBA, there are additional clauses being added for WBA where they're saying that you must have attempted to sit the clinical exam at least once or twice to be actually part of the WBA program. So I know our hospital does. So that is the reason why everyone's now very much interested in the clinical and they want to finish it off.
I think recently we heard from candidates, it was just fraction of minutes and it was not there. They couldn't get the slot at all. So we could see the frustration that these doctors had.
Yeah, and it has to be, I think a lot of them lost out because they opened it, they tried to check it first on their phone, and then it picked up the IP address, and then it wouldn't allow them to open on Chrome. And then they had to do it on the Windows. By the time they realized it was a matter of minutes. It was pretty sad.
So what do you want to say for such doctors who are stuck because they feel they're not progressing? Because if they have to wait for one more date, there's no certainty. Will they be able to secure an AMC clinical slot again when the authority opens or no? So any advice for them? How do they manage this wait time?
So I did release a recent post on my LinkedIn for this, and I think it's mainly because I saw it is disheartening to see candidates who want to progress in their career and unable to do so. And especially I have been in that role myself. One thing to realize in this time is that it's not lost time. The good thing about Australia is you can do other things to make your CV look good and also, in a way, work towards a specialty that you want to go into. A couple of my advice is listen, people book exams all the time and then they realize closer to the exam date that they can't. So just before the cancellation date, they realize they can't and they pull out so that they don't lose money or they only lose 50% of the money. So if you do have that, I would say always put an expression of interest in, get on the waiting list so that if you do and you continue preparing for your AMC clinical, because if you do, I remember one of our tutors got a notification come to them saying, hey, there's a slot open in 3 weeks. No one's going to be ready for a clinical exam in 3 weeks. So if you've been preparing, it's all well and good. So I would say go ahead and prepare. And if they put yourself in the expression of interest and you get a slot. So that way it's not gone to waste and you're not stalling. Second, you can definitely make this time worthwhile. So there is one option if you do have the financial means to go for masters in public health. Ideally you can do a couple of other masters like masters in hospitality if you are going for specialties that are highly competitive, like for example if you're going for cardiology, nephrology, if you're going for specialties like ophthalmology, dermatology, orthopedics, all of those, any surgical field for that matter, like neurosurgery, you need a thesis and you need a publication and you need a thesis. Along with that, every fellowship program, in the second year of their program, you're actually expected to do a research and a thesis. You can actually get this done with now and in an Australian university and do recognition of prior learning and say, hey, I've done it already. Can you just take the units out and reduce the time? So you can start working on that if you want to get moving along and if you have the financial means. Third, I would always say, what is the harm in applying for jobs? People are getting jobs after AMC 1. Go ahead and apply. And then when you get a seat, I know that AMC is releasing online exams for anyone that is working rurally. If you do, and IMGs get work rurally more than metropolitan areas. So if you are getting a job there, then you may be eligible instead of face to face. You might be able to secure an online AMC clinical date and work at the same time and get some Australian references. So getting your CV in, working on your CV, selection criteria, cover letter would be a great thing to do. I'll just get some observerships in because I know the applications are starting to open up.
That's nice. I guess it was a lot of information for doctors who are waiting for AIMS clinical slot now. So now you have your action plan what to do. Now, doctor, what happens is like when it comes to UK, like similarly, we tell them, okay, pass the exams or do publication research, conference presentations, upgrade your portfolio, try to have membership exams. And even after that, many doctors complain, but there are no enough jobs to apply in the UK at this point of time. So many doctors do ask us, is it the same situation in Australia? Like I passed my AMC Part 1, I put all my effort and I passed my AMC Part 2. And it shouldn't be like after AMC Part 2, I don't have jobs. Well, how's the situation currently for international medical graduates, doctor, in the Australia?
So currently, with the current economy, we do have jobs. So we are short of doctors compared to what the government is at the moment. We are looking to expand to reduce the wait times of our patients in EDs and in GP practices and all of that. So I do know that there is a shortage of workforce. So at the moment, but that's with the current economy.
And we also get to hear this question a lot. Many doctors say, I know I don't want to wait to give my AMC Part 1, Part 2. I just want to explore non-clinical career options in Australia. Do you want to suggest any for doctors who are seeking this kind of a role?
If you're not looking to do the AMC 1 or 2 at all, you can do the master's degrees, like the master's in public health. You could do master's in hospital management. There is a master's in medicine that you can do as well that takes you along the public health side of things. Unfortunately, the master's, the training in pathology, microbiology, pharmacology all require you to pass AMC exams because it's considered a clinical pathology. It's considered a clinical section. So any sort of those fellowships, you are required to pass AMC 1 and 2. If you are keen, another area that a lot of candidates do like to go into and not do the AMC exams would be if you're going into research, being as a junior research assistant, that would be the path.
Thank you, doctor. So many doctors do ask, How's the career progression in Australia? Of course, we tell them after your AMC, you get into your first mandatory rotation job. After that, once you get your general registration, you're technically eligible to apply for training jobs. But after that, they say, what next? Will they match to the specialty of their choice? After that, what are the final exams that's there for them to be called as a consultant? How's the career progression in Australia for doctors?
So once you're, from my understanding and from what I'm going through, once you're in the system, it's pretty straightforward for an IMG and an Australian grad. It's no different for either of them, and it all depends on the specialty training that you want to get into. So a GP is a 3-year fellowship, as opposed to emergency medicine is a 6-year fellowship. Most fellowships in Australia are about 5 to 6 years, and unlike the other places, this the fellowship you choose itself decides how fast you're going to finish it. So, for example, anesthetics is highly competitive. It's a very tough. Just to get into the anesthetic program, there is a 1 day interview that they hold with clinical scenarios, ethical scenarios. It's a morning and afternoon interview that they hold. So passing that is your biggest obstacle. Surgery, you have to do the surgical entrance test. So that's one side. You have another types of fellowship like the BPT, where the once you hit the requirements of the eligibility criteria, you have a half a day interview. Once you get that through, you only have a 2 to 3 part exam in between your 3 years. After that, it's based on your CV and how your applications and all your achievements during that training rather than anything else. And getting into ED, you just have to do the eligibility criteria and you have to have a strong support. But after that, you have an exam halfway through and then you have an exit exam. So most critical care rotation fellowships have an exam in the middle and also at the end. So, like I said, it depends completely on what specialty you take. But the good thing is that you're not really different from an Australian grad. Your progression once you enter the training is equivalent to an Australian grad's training.
Great, doctor. And thank you for it. Now, next question that we have is, because we tell, even I think many students, many doctors read a lot of things online, that Australian healthcare system is great, very balanced work life. Well, I know they're supposed to work hardly for 35 or 38 hours. A lot of things they read. But is that true? How's the work life balance in Australia? What is your day like as a doctor in Australia? How busy it is? Can you just give us few insights about it?
Yeah, absolutely. It is definitely hectic. I can definitely tell you our patient wait times are 9 hours. And my days, I work in emergency, so my days are quite busy. And also, patients are quite sick these days. So it's definitely busy. But the good thing about Australia is, like you said, the work life balance. Yes, we do tend to do more hours than we're allocated. But when we are claiming overtime, and there's strong advocacy from the AMA group that I am a part of. We've made a lot of initiatives and a lot of strides in getting doctors the overtime pays, the after hour pays, if they are entitled to it and if they put those hours in. And to be honest with you, most of our consultants and doctors are very supportive. Like our seniors are very supportive in claiming these times if we have put the effort and the time in. So, yes, you do tend to work more hours than you're allocated, but you do tend to get paid for it.
Doctor, is that a choice? Or like India, junior doctors are supposed to do it. Is it compulsory or is it a choice that whether you want to do extra or not?
It's a choice, but when you want to do something really well, it'll always go overtime. Most of departments are good. Like if it's like medicine and other departments where you can start winding up things when it's the last half an hour, 1 hour, it works. In emergency, ICU, anesthetics, you never know what that last hour, who's gonna rock up sick and throw the entire day off. So that's the only reason you end up doing it. But they're very good here in terms of preventing burnout and trying to get you doctors home.
And doctor, we could also see on your profile, you've also been a GP, or I think you got into GP training. I think some doctors have this, GP and emergency registrar. How is it? Will you be able to explain us a little bit about your journey so doctors will understand how
Yeah.
to?
So I was actually in the GP program, and I'm subjected to go rurally, because there's a clause called the 10-year moratorium, for IMGs. Unfortunately, I could not go due to family reasons. So I let that training go, and I'm in the emergency medicine training at the moment. You can do it. We do, a lot of emergency physicians are also GPs because it goes hand in hand. You see the patients firsthand, both in a GP setting or an ED setting. You end up seeing the patients first, usually at the first responders with the paramedics. And in terms of the GP, how it works is a lot of GPs also end up being senior registrars in ED, not consultants, but they end up being senior registrars in ED. And some are actually consultants. I actually have two consultants who are one consultant who's GP. So they do a dual fellowship. So they finish the ED training and then they do the GP training because GP is only 3 years. Otherwise, they finish the GP training and they do, like I have done, you do an ASIM certification or a diploma program. And once you've done that, you will work as a senior registrar. You can be hired as a senior registrar.
That's nice. Thank you, doctor. And when we tell for doctors who reach out to us for their AMC training or AMC consulting, when we tell them maybe as an IMG, like your first job, maybe a little towards countryside or remote side or an area of need. The next question is it possible to live there? Why can't we get it in Melbourne or Sydney or Perth? What do you have to say for this, doctor?
Each region's different. So WA rural is definitely rural as opposed to Sydney and Melbourne. It's based on a Monash classification. Do have a look if you get a chance. But going rural in a place like Victoria and New South Wales is not actually that rural. It's literally about an hour to an hour and a half away from the city. Honestly might be more affordable to have a house there rather than in the city, as the house market prices are quite high. So it's actually, we tend to live there more. And no, it's actually very well supported. If you are going quite rural, we do have some places like Port Hedland and Alice Springs, which are quite up north. They do support you with that. They do give you some supporting packages. Government has schemes to help you, create a community, and actually gives you funding to help you go there with housing and with relocation costs and everything. So they do support you quite well. So it's not very rural where you're in the middle of nowhere. You do have a lot of support, and you do have a lot of things in and around your city, in your town.
Thank you, doctor. And doctor, because you've been in Australia for so many years, so we just wanted to know, have you ever experienced a situation where being an IMG, you felt certain things are too difficult, it's getting a little too much on you, or you felt, okay, as an IMG, okay, these things are really easier. Anything that you want to share with the aspiring doctors in terms of your experience as an IMG in Australia?
Yeah, absolutely. Absolutely. Being an IMG and going outside of India, wherever you've done your basic degree and going out, it's definitely going to be more difficult. And I think we just have to accept that. If we're wanting to go out, we just accept it and we just, take it on board, because at the end of the day, we're the ones who want the change, and we're the ones who want to go settle somewhere else for difference, for change in the way we want to do or how we want to live our life. So yes, absolutely. As an IMG, I have faced like the AMC exams itself, which are quite difficult exams, but again, doable exams that have made it difficult, more difficult than if I was an Australian grad. But that kept in mind, would I not come to Australia? Not at all. I think I would have still stuck to my plan and have relocated here. I don't regret any decisions I have made to relocate here.
So otherwise in work life, doctor, there's nothing that looks harder for you, like compared to a local trained Australian doctor when you're working there as an IMG. Do you feel some kind of discrimination or bias, anything that you come across?
It's definitely not to an extent that I can't take it. No, they're very supportive. Australia is very much globalized. You have quite a mix of doctors and nurses and people you work with from all over the world. So we're very much used to it. And at work as well, like I love the people I work with. The only if I could go back to my hospital again, I'm moving hospitals. If I could go back, it's just for the people that I would go back for.
If I have to just look back, we started association with Dr. Balan sometime in 2022. Right, doctor? I guess that's the time
Yeah.
that we reached out to Dr. Balan and we requested her that, that we would like to bring in something like this, because she was very much held up at that time. She was doing different things. And then we said, no, there's really a demand. Let's work it out. And we remember doctor visiting Bangalore and we discussing about options. So I think in 2022, we took our first steps towards Australia. Of course, now we are doing multiple other options. That's different. So looking back, When we first decided to explore Australia as a destination for medical professionals, I clearly remember meeting Dr. Balan almost 4 years ago. At that time, the landscape was rapidly changing. Doctors were interested, and they were a little confused about AMC Part 1 preparation, AMC Part 2 preparation. After that, what happens? How do we navigate to the pathway? How do we apply for jobs? Because in Australia, applying for license itself is a little confusing. Doing that epic, doctors had, I guess, many doubts. And after discussing with Dr. Balan, I think, since if I just look back, we started with AMC Part 1, then AMC Part 2, then interview support, then job support. I think then CV review, CV edit. Now, I guess, doctor is giving job referrals and a lot of support. It's not transactional. It's not that, okay, just you took this, so you're getting this. No. So when we look back our association and our services for our doctors, I think we go much beyond, not just limiting to just training. Even Dr. Balan has been very supportive. Anytime doctor reaches out, whether it's for the job application or confused about which job to choose, how to go about, I think beyond those working hours, we've supported our doctors. So thank you so much for being that strong support doctor for our aspiring doctors who are looking forward to move to Australia.
No, it's an absolute pleasure, and it's been a wonderful journey with Go Campus as well. And it's been a wonderful journey knowing all our candidates, and I love the association we have. I think that, like you said, it's a beautiful relationship. And one thing that I love about our association and our collaboration is that we actually support the candidate if they pass the first time, or if they fail the first time. We're always there for them whenever they
Yeah.
have a question. So I think no, it's been an absolute wonderful journey, and yeah, it's been great knowing you guys. I still remember those Bangalore trips as well, and it's been great memories.
And doctor, I guess this one last question. I know because she's really busy, she's got to go, but I just ask her one last question. Because this is a very honest conversation. I mean, nothing is like, okay, we pre-planned something. It was just we just wanted to have an open discussion with doctor about the opportunities and all that. So continuing this discussion, many students reach out to us saying that, AMC Part 1 or AMC Part 2, I took training from that academy, this academy, or someone taking from our academy also. So we cannot always have this 100% pass rate, right? Of course, we have a very good pass percentage, but it cannot be 100% all the time. So many of even our doctors telling us later on that, okay, no, maybe I did not get this support. Maybe from other academy, I'm going to, I got some resources from the other academy, so I'm preparing now. A lot of these things on this academy. How important do you feel is the role of academy kind of pushing a doctor to pass the exam? I know academy training is important, but is it all academy, or what do you have to tell for doctors who are preparing for either AMC Part 1 or AMC Part 2, doctor?
So, from my personal experience is that whenever you're going towards something new, it's always good to get guidance from someone who's done it and been there, right?
Mm.
It's always good to get an advice as to how it's done, because it's a territory you're not familiar with, and you don't know much about, and you don't know the full story about. And like you said, there are a lot of academies out there, but it's also the candidates' responsibilities, because you guys are adults. They're adults. It's their due diligence it's to make sure that they choose the right academy. And each candidate has a different study approach. Each candidate has an approach on how to practice medicine, how to approach medicine, and the way they need to support. I think one of our strong suits is that we try to accommodate, and whenever a candidate, I feel like whenever a candidate says, ma'am, I need something, I need this support to
Yeah.
kind of pass the exam, I think we've kind of jumped in and kind of supported that. I think you have been very supportive of
Sure.
me whenever I needed that help as well. And I think you've done the same for me when a candidate required that from both of us. And I think that's the thing. So in terms of the academy's role, like you said, yes, it does play an important role. But as to what an each academy offers, I think that is something that you will need to make an what do you call an informed decision by checking out what are the resources given to you by academy. We are always choose an academy. My advice is always choose an academy that's black and white with you, because if they're not, then you don't know what you're not getting services to. And second of all, I think it's very important to give feedback, and constructive feedback. Accusing someone will never get you anywhere, but
Sure.
a constructive feedback and say, ma'am, I'm not really getting this. Can I get a bit more of this? And I think that we're always happy to accommodate that.
And how much of it is because we see doctors, they're going with Q banks, they're purchasing recalls, they're taking live classes, they're taking recorded classes. Apart from this, they're going with 2, 3 other resources that's available. Is so much really required. Even for AMC Clinical, we see doctors taking online training from here, multiple trainings from different resources. Again, come there for face-to-face training with a different resource. Is it all going to be too confusing, accessing multiple resources from multiple places? Or is there something that you want to give a small tip to these doctors which will help them to prepare for their exams?
Absolutely, because this is absolutely is going to be confusing and you use too many resources. Even for your fellowship exam, say you pass all of this and you're getting into training, when you use multiple resources, it's no longer going to be straightforward and you're going to confuse yourself when you're ready to sit the exam. There are candidates that have just passed this exam just by taking one course or not even a course at times for certain parts of the exam. So just by doing the Q bank or just taking one Q bank, doing multiple Q banks is going to confuse you. And one of the main advice I give to a lot of candidates, especially with the clinical exam, is that my approach, if you're going to do my course, I want you to stick to my approach, because that's not what I can 100% tell you that's not what another mentor is going to teach you how to do it, because that's not how it'll vary. No human is right. And then from the technique that I teach you, you need to put your own skills into it that makes it easy for you. Because if you go to an exam under the stress, under the pressure, you're going to do what your habits, what you're comfortable with, and what your habits are. So that's what you need to become more natural. So, absolutely, my advice would always be, do not confuse yourself with multiple resources. Stick to one resource. Make it simple. It's already a complicated life. Don't make it more complicated. Just keep it very straightforward. These are the topics. This is the guideline. This is how I'm going to go for the exam. Because
Exactly.
otherwise, too many cooks spoil the broth.
Yeah,
Don't.
yeah. And we see that frustration and stress because we understand they're going through the exams and they know that because they get to read so many things. Online exams are really tough. AMC is very challenging. It's not easy like other exam. So they try to get as much as material as possible from different sources. So that's what I also feel, that they're getting confused because they're trying to access this, they're trying to access this, they're trying to access something else. So in all this, I think they're getting confused. What should they actually do? That's why I asked you the question, and thank you for your insight.
Yeah, no, absolutely.
Yeah. So now, very happy news is coming up. So we are excited to take this partnership to the next level with new opportunities and stronger support for doctors, that is for IMGs preparing to enter the Australian healthcare system. So this is happening for the very first time in India. So Go Campus, in collaboration with Dr. Balan, is launching a face-to-face AMC clinical course in Bangalore in November 2025. So you can see more details of it shortly. After some time, we will start announcing it on all our social handles. So if you're interested, please do talk to us. I think you know how to reach out to us. All the details will be given in the description below. So do not hesitate. If you wish to book a seat for the November batch in India, that's in Bangalore, do give us a call. We'll give you more details about it.
I'm definitely looking forward to seeing you all there. You can ask all my students. I do love a good face to face session and I do love a good banter. So, yes, no, absolutely. I'm looking forward to seeing you guys all there.
Thank you so much. Thank you for being so supportive, so kind to all the doctors looking to move to Australia. And also, you've been a great partner for us to work with. I hope this session is really insightful, informative for all the doctors who are looking forward to explore Australia, whether you could be a MBBS doctor or a specialist. If you wish to talk to us about all our services, as I just said, AMC Part 1, Part 2, your mentorship or your CV preparation, interview skills training, anything that you want, we are there. Reach out to us. And if you want to book a call one-on-one with Dr. Balan, it's www.gocampusworld.com. So thank you so much, Doctor, for your time. It was really very informative. And thanks again.
I hope I haven't confused anyone. I'm happy to have a chat. Thank you for having me on board.
Thank you, Doctor. Thank you so much. Good day. And thank you to all of you watching this today.